Good to know you're still with us. Let's talk the latest figures. Nigeria is the second country with the highest number of maternal, neonatal and child deaths globally. This was revealed in a new report by the World Health Organization, WHO. While India accounts for 17% of global maternal, neonatal deaths and stillbirths, with 788 deaths per thousand, Nigeria accounts for 12% of global maternal, neonatal deaths and stillbirths, with 540 women and children dying per thousands as of 2020. The report, titled Improving Maternal and Newborn Health and Survival and Reducing Stillbirth, Progress Report 2023, reveals that maternal and infant mortality rates in Nigeria have stagnated since 2015, with approximately 290,000 maternal deaths occurring annually. The report also highlights that more women died in Nigeria from pregnancy-related issues than in India and other countries in 2020, with 82 women dying per thousand. The report attributes the crisis to the COVID-19 pandemic, increasing poverty, worsening humanitarian conditions, and inadequate funding from some countries. Sadly, no one is shocked by this latest report, or ranking, if you please. But what is troubling is that the needle doesn't seem to be moving at all in progression. To speak on this, to understand why, and to look for a way forward, I have Dr. Roland Aigbovo, the Vice President, Commonwealth Medical Association, West Africa region. He speaks to us from Abuja, Nigeria. I also have Dr. Noble Dialins, ART clinician and founder, Saving Women and Children Foundation, Lagos, Nigeria. Gentlemen, thank you for giving us your time. Let me start with you, Dr. Dialins. What worries you the most about this latest ranking? Noble, can you hear me?
Yes, I can hear you. Thanks. I'm very happy to be on the square today. My worry with the latest ranking is that Nigeria, as a model, is nowhere near the SDG goal of reducing maternal and infant mortality to at least 70 or less than 70 deaths per 100,000 live births. Currently in Nigeria, we comfortably sit at around 540 maternal deaths per 100,000 live births. That's alarming. That's a thing to worry about. And if efforts are not made to tackle this on time, it may keep escalating more than we can control.
Dr. Roland, you are covering the Commonwealth area and you know what is happening as well. Can you give us a picture of what the current efforts are in trying to address the rate of maternal and child deaths in Nigeria and where we need to go?
All right, thank you very much for having me this afternoon. Well, like you all know, a lot of African countries actually have a higher maternal mortality rate, and the reasons are obvious, but it has, even since 2001, when the Abuja Declaration of Improved Funding for Healthcare, with the Abuja Declaration of 15% for budgeted for health, had not been achieved by any of the African countries, except the one that was close by was Rwanda. A whole lot of gaps are there in healthcare services that have been provided in Africa. In comparison with countries who have the high-income countries whose maternal mortality rate is even less than 100, or some are even about 80 something, below 100 by 100,000 live births. So in Africa, we are still grappling with the issue of funding funding of the healthcare system in Africa. And that's what explains the high maternal mortality rate.
So
and,
go ahead.
Yeah, and it boils down to we not putting in place those measures to actually take care or actually mitigate against this maternal mortality? I hope, for instance, if a system is well structured to actually provide care and provide services, especially antenatal, I think a whole lot needs to be done to ensure that the people actually also on their own part access those services. Apart from accessing those services should be available at their beck and call so that these mortality rates can be addressed and brought down.
All right, Doctor, I was actually going to interject and say that these issues are not new. I mean, the challenges has been there for quite a while, but the idea is to move the needle a little forward by 2030. So I want to ask you, between the report is looking at what happened in 2020, though it is released this year. What, to your knowledge, is being done to push the needle forward a little? Let's focus on Nigeria with the second highest rate at the moment. What is being done that you notice that is different from the status quo we had before, that is showing some kind of improvement in addressing this issue?
Well, a whole lot is being done in Nigeria. Why it seems that the rate is not actually being affected by the effort that is being put in place is because there is still a whole lot of gaps. I will still say that. Because if at the secondary level of care and tertiary level of care, these efforts are geared towards mitigating the increase in maternal mortality rate, what about the primary level of care? Because most times, especially in the rural areas, they hardly have access to antenatal services. Situation whereby you have primary healthcare centers where they cannot attend to deliveries or can attend to those qualified personnel to handle antenatal services and even delivery. Of course, before they get to the secondary facilities or even the tertiary facilities, a whole lot would have gone wrong. And that's where come to play the issue of delay. The delay making a decision, delay in getting to the facility, health facility, and even the delay in taking a decision right there at the health facilities. So these are the three delays that is being talked about when it comes to maternal mortality, which we need to actually work on. And we keep saying that the primary level of care is almost non-existent in Nigeria. And this is the first port of call where we have to deliver effective and efficient healthcare services. And then people need to also, especially women and even adolescent girls, need to understand that pregnancy is not just a tea party. Yeah, apart from, because when you are talking about maternal mortality, you are talking about pregnancy and pregnancy-related death up to 42 days or 6 weeks after delivery. So whether a termination of pregnancy that is carried to term and delivered up to 42 weeks after termination of pregnancy is still the same period we're talking about now. A whole lot needs to be done to sensitize the girls, adolescents. Yeah, Nigeria today, abortion is still illegal, but a whole lot of abortion is being done in Nigeria, it should be told. The fact that it's illegal, but it's still being done. And these are also some of the things, some of the actions that contribute to the maternal mortality that led to increase in maternal mortality. So awareness needs to be done with about adolescent health, then access to care, effective and efficient healthcare. And healthcare financing, if I have to debate a little bit, actually meant to bridge this gap. But how well has this healthcare financing helped to reduce maternal mortality rate is another thing that need to be looked into, because accessing care is key. Then training of traditional birth attendants. Most of the rural areas, they rely on the services of traditional birth attendants. Yeah, they are, well, it's something that is age-long, but I think that the Society for Obstetrics and Gynecologists of Nigeria need to actually come together and train those traditional birth attendants for them to know, because a good doctor or a good healthcare provider is the one that knows when to refer a patient for further care.
All right, Dr. Roland,
attendants should know when to refer patients for further care.
You've really spoken extensively, and there's still so much area to cover. I'll come back to you in reference to what more we can do with campaign. We have about 10 minutes, but let me go to Dr. Noble for now. You mentioned, Dr. Roland, you talked about primary port of care being almost non-existent. I'm trying to paraphrase your words. So, Dr. Noble, my question to you is, where do we start? How do we begin to, because the point of this conversation is to see how we can move forward. We cannot continue to be second in the world with maternal and child mortality rate.
Thank you. As Dr. Roland has said, there are some blueprints that have been laid out already, which is COVID, for example, was quite a special year. There was limited access to a whole number of things, traveling, moving around. The health sector was not left behind as well. So we have moved past COVID. The federal government so far has tried to improve physical access to primary health centers. Apart from that, the plan has also been to make primary health centers functional across all wards. They have also shed some light and made efforts to increase financial access to funds to actually reduce maternal and infant mortality. And last but not the least, they have also found ways to mitigate shortages in emergency services like provision of ambulances and so on and so forth. On paper, it is perfect, but the challenge here still remains on implementation of this blueprint, as I've earlier said. So it doesn't just rest on the government alone. There has to be a collaborative effort and partnership with NGOs whose thematic areas are targeted at reducing maternal and infant mortality. Because the truth be said, we can't expect the government to touch all areas. There are so many hard-to-reach communities in Nigeria. That's where the NGOs come in. That's where the traditional birth attendants come in. Training them, giving them the skilled knowledge to identify problems, know their limitations, and also identify issues they can't handle and link them to secondary care. So I would say is we have done well so far, but implementation and partnership to ensure that those in the hard-to-reach communities are met is very, very vital and key for us to move past this.
All right, Dr. Roland, I'll come back to you on the issue of awareness, creating more awareness and education, particularly for those in rural communities. You also raised the issue of traditional birth attendants that Dr. Noble has also talked about, training them a little more. My question would be to elaborate a little on what WHO and other organizations can do to help the Nigerian government create more awareness to reach the interior parts of this country, where we know that internet, as much as it's touted to be everywhere, there are communities that still don't have it. There are people who don't have mobile phones, not to talk of having access to the internet. So how can we do this?
All right. Nigeria is a diverse country with so many communities that are both connected by land and then by water and all of that. That's why I mentioned the issue of primary health care. Most of these hard-to-reach facilities have primary health care facilities, but the problem is staffing. One of the measures that the federal government has actually put in place to reduce maternal mortality is the midwifery service scheme, where midwives who just graduated are sent to primary and secondary health centers to render services and all of that. Of course, it's helped to reduce the maternal mortality because they have to bring in their expertise and all of that. But let's focus on the primary level of
I think
trained professional. They need to have a well-trained professional, either a midwife or a doctor that can handle pregnancy-related issues. If we are putting in a community health extension worker or a junior health, these are not people that are well-trained. except they have to undergo a further training on how to manage pregnancy and pregnancy-related issues. If we don't do that, we'll still just be grappling with whatever issues that we have today. Now, the issue of World Health, I know that WHO have a whole lot of programs, partnership with Federal Ministry of Health and other non-governmental organizations. Now, the issue of partnerships should go beyond just paperwork. It should go down to the primary or the end users. End users now being especially people living in the rural communities and all those hard to reach communities, as Ella mentioned. Those hard to reach communities, people are living there. For instance, we just had an election in Nigeria. People living in those hard to reach communities voted in this election. So if we have to go through the pain of taking the ballot materials to people in those hard to reach locations, for them to come and vote, we should also go through that pain to provide healthcare facilities in those hard to reach areas. Because those hard to reach areas are not just places that it's not an island that has nobody. The people are living there. Primary healthcare facilities are being marked or even built there. Making it functional should not be a Herculean task.
Okay.
It shouldn't be a Herculean task.
I think that's the one thing I'm taking away from your submission. But before I make mine, let me hear from Dr. Noble, your concluding thoughts.
A lot has been said about this. The challenge is in some of these hard to reach communities, sometimes we call them volatile zones. They have been saddled with a whole lot of insecurity. So the percentage of skilled workers that will be willing to go to those hard to reach communities, they are very minimal. Let's be factual as possible. You don't expect someone to go into a zone that has been declared, should we say, unsafe. So the government should strengthen efforts in tackling insecurity because, like Dr. Roland said, there are people living in those places. Some of them have access to technology, some don't have access to technology. So community involvement is very, very vital because, of course, making policies, it's easy to make policies, but the implementation is where the work has to be done. So those communities have to be reached. The government can, like I said earlier, the government can't truly reach everywhere. So that's where partnership, collaborative efforts, and ways, it doesn't just end on partnership. There has to be ways to monitor these projects. There has to be some evaluations. Before you came into the zone, how many women had access to antenatal care? How many are now accessing antenatal care after you have come? What is the regress or what's the surge in the level of maternal or mortality since you're coming? So all those metrics are very, very vital to know if we are winning or not.
All right, Dr. Noble and Dr. Roland, I thank you very much for giving us your time.
Thank you very much.